everybody, it's Jo here from Canine Kinetics. Look, it's been a hot minute. We're in our brand new facility. Been here for about 9 months now, which means I've got a little bit more extra time now to get back into these videos. And today I thought we'd look at MPL rehab post-surgery. This is Frankie. She's a 2-year-old English bulldog. You may remember her from previous videos when she was just a tiny little pup and we were doing some hind end awareness with her. 2 weeks ago she went in for bilateral MPL surgery. Her left one was much worse than the right and had a little cartilage flap sitting in there, which was pretty uncomfortable for her. I guess the post-operative protocols for these kind of dogs is in the first 2 weeks you have to get the home set up right. Now Frankie was crate trained as a puppy, so her crate is quite comfortable for her. She doesn't mind being in there, and we did start her in the crate. For me though, trying to get her in and out, getting down on my hands and knees, trying to wiggle her out because she wasn't able to walk in the first couple of days was quite taxing, so we actually upgraded her to a pen, and she was really good in a pen. She didn't move around, she knew the assignment. So I suppose you've got to decide what's best for your dog. Within the first 2 weeks, confinement is important to allow the healing, but you've also got to consider their anxiety, their comfort level, are they stressed, and make a decision for yourself. Initially, you know, we were just taking her out for toilet breaks only. Live in an apartment, so we had a real grass toilet out on the balcony, and we were using the little towel sling to help shuffle her out and take some of the weight off the back end. But then we ended up putting a help 'em up harness on, which was much easier, and we allowed her to sort of sleep with that on throughout the day, so it was just much easier for us to come in and help support toilet breaks. Medications, also very important. Make sure you're feeding your dog all the medications at the right time with food if prescribed. It's really important you try to maintain or control the swelling and also their pain levels. Frankie unfortunately did swell a lot, and all her swelling went south of her knee and ended up in her hocks, and so we used a variety of different treatment techniques to try to get that out, including the good old staple of icing. We were icing her legs with these little ice cuffs, about 15 minutes at a time, 3 times a day. I also tried some kinesiology tape, the octopus type taping, which is supposed to help with the lymphatic system and help clear out the swelling. I also had an LED red light wrap that I was using, which is sort of more for superficial stuff but can help with the lymphatic system. And I was also doing laser for the healing deeper in her knee joints as well. In terms of exercises, all I was doing was passive range of motion. So with Frankie in a side-lying position, or a dog in a side-lying position, make sure you support above and below the knee, and you're just doing some really nice flexion and extension, sort of bicycle movements through the knee. At this stage, sort of 2 weeks post, you'd want to sort of see about 70 degrees stifle flexion and anywhere from about 130 to 150 stifle extension. Along with that, sort of towards the end of the 2 weeks, I started doing some very basic weight shifting exercises with her, postural perturbations and standing. As you can see, she did prefer to extend out through her legs when doing this exercise, which, you know, as a beginning I'm not too fussed on, but moving through, progressing, I'd like to see her bring her legs in a little bit so they're not so abducted and not so extended. Frankie is due to have her stitches taken out in 2 days' time, and hopefully from there we will get the all clear to move forward with her second stage of rehab and get her into the hydrotherapy pool, and also begin some more targeted weight bearing exercises. So stay tuned for those exercises, they'll be coming up next. Thanks.